So you started off in?
Okay, actually, we started off because Renee, her mother, and I taught at the same school. And so I knew about Amy when she was going to dental school. And then when she graduated from dental school, then she had an office in Jewel that she came 2 days a week, maybe 2 mornings a week, and then she had started her office here. And so until the office here became too busy for her to be in Jewel, then she closed the office in Jewel. So I started going to her when she was in Jewel.
That is awesome. Like, I don't have experience going to Jewel, but I started coming here a while ago, and it's always been Ames.
Right.
So how have things changed since you first started, like from Jewel coming to here?
Well, she has a lot more technical stuff, you know, and I know the last time I had a cavity filled, it certainly there was no drill involved. It was, I'm not exactly sure, you know, but something with laser, you know, that she uses, and that's pretty cool, pretty easy. You know?
It's super slick. I feel like a lot of our patients come here just for that. They're always intrigued.
Just for that, right? Yeah.
Yes. And then I guess what other experiences? Like,
okay, I have 2 really good experiences. One of them was I taught first grade for years, and I had a little Hispanic boy, and he spoke good English, but his parents certainly did not. And he came up to me on a Thursday and was telling me that his tooth hurt. And so I said, oh, you know, I'm sorry, and make sure you tell your mom, you know. And so then the next day he comes in and, oh, his tooth hurt, and oh, he was just miserable. And so I decided he was not going to go home for the weekend and have this toothache all weekend. Because have you ever had a toothache? It hurts. So I was trying to get a hold of a dentist that would treat him, would see him. I called a children's dentist in Ames, and he said, no, that we could make an appointment for Tuesday. This was Friday. And I said, no, this little boy needs to be seen. So I called Amy. And Amy at that time had little kids, and she was the only one that would see him. She called her babysitter, and she made arrangements for the children, and Mario and his mom, and then the Spanish teacher from school brought him down here, and he was treated. And Amy had no idea if she was going to get paid for this, because obviously they didn't have insurance, but we did have a fund at the school for emergencies, and we made sure Amy got paid. But Amy had no idea if she was going to get paid or not, and she was the only one that would see him on that Friday after hours. I think they got here about 5. And I said right then, well, she's stuck with me for life, because anybody that would do that I was impressed. I mean, I always liked her, and I always knew she was kind, but that was above and beyond. So
that's awesome. I've never heard that story.
Yeah. It happened.
That's so sweet. And
yeah, it was very sweet. And then he came up to me on Monday, and he said, Mrs. Vest, I can't eat candy anymore. I said, oh, that's okay. Maybe it'd be better for you to eat, fruits, maybe an apple, And I don't know how long that lasted, but.
Oh my goodness. What was your other experience?
Oh, well, another experience is when you make impressions, for, like I had a dental implant. And so they had to do the work in Ankeny, but then she was going to put the crown on. And you have to make impressions for that, and I hate impressions. I mean, I'm sure I'm not the only one. So, and one time when I was having impressions made for something, they had a hard time getting isn't it called a tray? They had a hard time getting that out. Oh, gracious. I was just not looking forward to it. So she puts that tray it was in the upper teeth, and I instinctively put my hands on her hand. Now, what did I think how that was going to help? I have no idea. But I put my hand on her hands. I didn't pull or anything. And she didn't say anything. She didn't say, ask me to remove my hands or remove them herself. She just let me keep my hands on her hand while this was happening. She just seemed to know that for some reason that gave me comfort. And then when the impression was done, I took my hands off and she took the tray out and we were both happy.
That's fantastic.
Yeah, it was very nice.
See, these are like stories I don't always hear. That's why I like doing these.
Yeah, yeah.
So,
She's kind.
yes.
And she knows that not everybody, some people don't like coming to the dentist. I don't mind coming to the dentist as long as I don't have to have an impression done.
I guess since, from 2001 to now, what would you say is the best part of our practice that you've enjoyed?
I guess it's the fact that everybody is very kind and very nice, and they try to make sure that you're comfortable. You can have your hands dipped in the wax. You can get a heated pillow. You can get a heated blanket. Anything for your comfort. So that going to the dentist, is something that isn't. When I was a kid, going to the dentist was a very scary thing to do. And they just expected you to just open your mouth and shut up, So this is a whole lot nicer. Everybody's very caring.
That's been like my mom's experience growing up too. Like the dentist was.
It's terrible. Yeah.
What would you say to someone that's considering coming to our office as like a new face?
Well, I would say that I would think that you would be very pleased with the service, with everybody. I think you're very organized and very caring, and everybody knows what they're doing, and you're not really just a number. You're a person. You're part of the family, and I like that. So I would tell people that, and I have to.